The other part of this is if you have questions about these particular programs, these are the people to come find. And I know there's a lot to it. The next part is the workforce. We've really recognized, and I know this is one of the things that everybody that's working in this program is struggling with, how to find enough people that know this language, EHRs, informatics, coding, business process change. It's a different kind of language than typically going to work and practicing patient care. So there was recognition that we had a workforce shortage. Also, as part of the stimulus bill, the idea was to take people who are unemployed and get them trained, and that's how this program was originally structured. One of the things that we've seen change over the last year is that there's a recognition that it's not just new worker training, but there's really a huge need for incumbent worker training. So whether it's the IT or the medical staff or combination thereof, really huge need for the incumbent workforce training. And ONC has shifted some of the ways that they're administering this program to make that more possible. So our workforce grantees are really working on reaching out to the incumbent workforce as well. And we in California are part of the Western Health IT Regional Consortium, which includes 4 states. So out of that, about $9 million is coming to California. The overall grant's over $10 million. They've already trained, had 2,000 people enroll, 712 people have completed the programs, and I think the other piece that we're going to see more and more of is the folks that are going and doing the incumbent training and getting specialized, customized subsections of that certification program. So they're actually taking, here's this overall curriculum, which part do you need, and helping to work with different groups around that. So do we have folks from the workforce programs here? If you could stand. All right. So the one that's near and dear to my heart, the State HIE Cooperative Agreement is the grant that came to the CHHS, the California Health and Human Service Agency. And this is the 4-year grant. And again, it has two main purposes. One is to really drive adoption of health information exchange in the state. And the other is this coordination piece, really working across the different stakeholders, working in particular with Medi-Cal and public health programs, and working on the privacy and security pieces as well. So we received the grant. We receive a portion of that stays at the agency, but the majority of that we've been sub-granting to Cali Connect, our nonprofit state governance entity for HIE, and really pleased to be partnering and working towards these goals of this grant program. And this really is, a key part of this is not just HIE, but it's the things that HIE touches. And one of the things that we've heard from the ONC is that some of these areas that really need that kind of technical assistance, like labs, pharmacies, public health, they expect us to be using some of these dollars really to help support that activity. So that's a huge part of our efforts, obviously. Oh, so sorry. I was already standing. So everybody else, though, which is a huge team, that's under the HIE Cooperative Agreement, our Cali Connect staff, our CHHS staff, if you could please stand. And then the extension to that, a huge part of the way this program is administering is to our HIE expansion grantees. We have 5 of those. And do we have folks from those grantee programs here as well? If you could stand. Thank you. And you especially see those folks along the outside at the table. So please go find out what they're doing. And they're really doing a lot of tremendous work and pilots and getting this going on the ground. So the next area that really was highlighted as part of the HITECH Act was the broadband piece. As Undersecretary David Maxwell-Jolly was mentioning, we have many very rural parts of the state they're in the outer reaches. And they don't have connectivity. They don't have ways to move the information. So the broadband piece in terms of how we connect is also a critical part of this. And the state really has been committed to this for a long time. And it kicked off before HITECH with the FCC Rural Health Pilot Project that has a goal of connecting over 800 sites. And then it was added to with the HITECH Act with the Broadband Opportunities and Training Program, which is identifying model communities that will be receiving grant money as well, but also the pairing up with the California Telemedicine and eHealth Center, which ties into what is it we're using that broadband for. So how do we start delivering care at a distance, recognizing that the drive is long, that patients may not be able to wait that long, or they may not have the ability to make that travel, especially as we head into the winter months when we have roads closed, snow happens, floods happen, but yet we still need to communicate. So this really is helping to serve as some of that core backbone that helps make this communication happen. So do we have folks here from the California Telehealth Network, Telemedicine? These are folks you might want to talk to. So as I shift to this next one here, this is another one of our spider diagrams. But I've just highlighted a number of the different programs that are part of the high-tech grant. Specific stimulus dollars. I really want to take a few moments before diving into this to recognize California has made a huge investment that's gone way beyond high-tech. It's been private, it's been public. Examples with the broadband, the FCC grant, and the matching funds that came to that out of our funds here in California. Huge investments, and whether it's HRSA grants, ARC grants, other activities under the Affordable Care Act, private contributions represented in some of our sponsors here. The sponsorship for this is just a small piece. I think almost all of our sponsors here have really been making other huge investments. Our different foundations have done a tremendous amount to really advance and identify pilots that they can help move along throughout the state. And so the funding environment, again, high-tech is a seed, but it's really much broader. One of the things that we want to really come back to you in a year from now to describe is what that map looks like that really expands on. There's the investment of high-tech, but then there's really the investment of California in terms of how we've raised this as a priority and how we are transforming the landscape through these many different activities to recognize that. And so along those lines, this is our map that shows the different ways that we're working on keeping things connected. There's the eHealth Coordinating Committee, there's the many advisory groups of Cali Connect, there's the boards of our regional extension centers, as well as their outreach, the workforce, the telehealth network, the many associations that are working with their members to help transform. Just a tremendous amount of team effort and really appreciating folks taking the time each month to stay connected. So anybody who's sitting on any one of the committees represented on this chart, I figure you probably know who you are. Could you please stand? It should be about half the room. You don't have to be shy. All right. Okay, now, okay, sorry. Now the next one, though, is anybody who's on any sort of, not necessarily on this chart, any sort of HIT, eHealth, committee, work group, in your local community or hospital, doing something related to this area. Could you all stand? Federal, state, local, private? Fantastic. Yep. I mean, I think what you've seen in watching different folks stand throughout the room, this really gives you an idea of the huge cross-section that we have here today. So really take advantage of that. Introduce yourselves to each other and find out what you're doing, what's working, what's not working, what do you wish was working, so that we can help prioritize our next steps. So as I start to close this up, one of the things that I wanted to touch on again, Undersecretary mentioned this as well, is our breakthrough goal. One of the things that the Office of the National Coordinator, when they came to do our site visit in June, they wanted to find out how we were doing on our program information notice activities, and in particular around things like e-prescribing, structured lab exchange, summary of care records between unaffiliated organizations. And so they asked us for a project plan related to how we were going to be working on those things. But they also said, you know, just just because, we want you to come up with a breakthrough goal. And they specifically said that it represents bold, audacious statements of achievement around which your state and its leaders can strive beyond the state HIE cooperative agreement program period. And they did give us a whole month to work on it. But it wasn't that hard to work on because, as Dava mentioned, we ended up really landing on things that we've been working on. This is not really a new goal. It's just a new way of highlighting this goal, which is to recognize that we have some patient populations, children in foster care, people that are in and out of long-term care and working on that long-term care environment that are really potentially going to benefit in a huge way by health information exchange, by improved management with EHRs, with personal health records, that can really transform their care. And so we landed on those two populations as two populations that we particularly take care of with our state and federal government programs, but also as populations that we've been working on through a number of areas, our Blue Ribbon Commission around child welfare, and work around the Olmstead Commission that has gone long before we ever started this. So this is a way of really kind of highlighting this and bringing it together and knowing, because we've been working on it, we will continue to work on it after this grant goes away. It's not just during this 4-year time period of the grant. So to make it somewhat finite so that we could get our hands around it, recognizing there's many, many issues in both of these populations, we chose the personal health record as a place to focus and the potential use of the personal health record for these populations and how we as state government could potentially interface with such a personal health record to help serve those populations. And part of the reason for doing that is recognizing that, again, going all the way back to the beginning, the second policy priority area of the CMS program, engage patients and their families. We haven't seen a lot of activity around that in the current meaningful use measures. But this was a way to help highlight that particular piece and start to get our hands around it. As I know many of you know, personal health records, there's a lot of complexity to that as well. Tethered, untethered, where does it sit, all that kind of stuff. But a key piece of it is that it empowers the patient and empowers the patient to have control over who sees what, which helps address a number of the issues around consent. And so it also, though, again, engage patients and their families. How do we do that in an effective way to make sure that in the midst of all of this, high-tech EHR, HIE, we make sure that the patient stays as a central component to all of the work that we're doing? How do we help the patient be empowered to take care of themselves? So this breakthrough goal that we were asked to identify, which we said in the first 6 months we'd work on identifying the landscape, and in the first year a potential pilot, and then in 5 years looking towards having options across the state, is really to try to drive at that kind of conversation. So it's bringing in another part of the conversation. I suspect we'll see more of it in stage 2, meaningful use, but it really drives at how do we care for our patients and have our patients be involved.